This is a patient who has a chronic history of recurrent PEs. He presented to the hospital with dyspnea and fever. I'm just going to scroll through the lung window once. He has a positive metapneumovirus infection as well. So that's why you are seeing all these findings. But I want you guys to focus on the mediastinum and the vascular findings. History of recurrent PEs. CTF. Good. Excellent. So this patient has a CTF. How we know? So patient has clearly a history of, PEs, and other thing is the pulmonary arteries enlarged, as well as the right atrium and the right ventricle is also enlarged. We do not know what phase this scan was taken, but you can clearly see some buckling of the interventricular septum towards the left side. When you put all these things together, CTEPH is the diagnosis you need to give. This patient consequently underwent cardiac MR. Let me show how is the strain pattern it. You can see in the cardiac MR, if I put the roll in the cine, you can see the dangling of the interventricular septum. We call it as a septal bounce or interventricular dependence. This can be seen in constrictive pericarditis and also in patients who have CTEPH with RV strain. So the diagnosis, not only you mention in the CT report that the right atrium and right ventricle is enlarged, but also you have to mention that the septum is buckled towards the left. Then the patient gets a referral to cardiology. So evidence of RV strain. And the other thing is to look for when you have RV strain is make sure there is no hypertrophy along the RV wall. So patient with CTEPH with RV strain.